with what goes on in the afternoon on Tuesday. Um, you may have triage patients. You may not. Willie will have made the packages for you that include forms that you're going to need for pre-op and Wednesday daily notes through the following Monday. Be sure to update the ortho list with the MRI information because you're going to need that when you dictate your op note so that you can include the MRI results. Also, you may need to tell Dr. Chambers what the MRI results are on people that are getting their MRIs done on Tuesday. Be sure to include the vascular results. You'll be doing the consents, the surgical consent and the blood consent, doing the NPO orders. You need to do a heart and lung exam, which will be, the form for that is included in the bundle. And if people are non-operative, you need to order splints. And when you order a splint, be sure to, there is an order form for this. It's the non-op order form that you can find in the forms on the intranet. Be sure to incorporate the cast shoe and order physical therapy for gait training. Put down what the weight bearing status will be. Then you can call any additions or subtractions to the operating room before 5 o'clock, and their phone number is 7384. And then before you go home, be sure you check for any late admissions. Then Wednesday morning, I recommend that you get in around 6 o'clock so that you can check and see who was admitted overnight. Not that you're probably going to do anything about that, but just so you have an idea of what needs to be done, because people are going to start calling you if something was left out, like medication orders for pain meds, etc. You may need to be looking up labs that were drawn at 5 a.m. There's orders on the NPO orders for crits and PTTs to be drawn again at 5 a.m. You may need to be looking those up. You also may be listening to the linear system to get the readings on MRIs that were done after you went home. Surgery either starts at 7 or 7:30, so you really need to be over in the pre-op area around 6:30 to start putting out fires. And Rafat will be there to help you, but he is not very timely. Unfortunately, he drives in from Glendale and sometimes he gets stuck in traffic. The things that you need to do, which could be done at the end of surgery but is easier if done ahead of time, are the post-op day 0 orders, which you can fill out and sign, but don't time them until you finish surgery. Do that as you walk out the door, because the nurses have 2 hours to get the orders off, and if you time everything at 7 a.m., if the patient doesn't get back until noon, then they are um, they're marked as being late, and they're not late. We also need to do the transition to community form for the appointments for the first 3 Mondays for people with 2 feet after surgery, and for the second and third weeks for the Symes and above patients. We also need to do our part for the post-discharge care instructions, and Rafat will help you with these things on Wednesday morning. So I'm going to stop here and I'll pick up with Wednesday afternoon.